Hi, and welcome to the VOILA Method podcast, Solutions for the Mind, Body, and Soul with Joel Crandall, the creator and developer of the VOILA Method. The VOILA Method bridges the gap between the complex, making it simple, using an assessment and a treatment protocol that aligns the mind, the body, and the spirit. VOILA Method is more than a technique, it's a lifestyle to help you as a practitioner and your clients. And today's guest, you probably have all seen his amazing videos. It's been on YouTube and Facebook with Dr. Chris Barnes of Tensegrity Chiropractic out of Tulsa, Oklahoma. He's a sports chiropractor. Thank you for joining us. I know you're busy, Chris.
Yeah, good to be here.
Excellent, excellent. So I have a couple quick questions for you. And the first one I always like to start off with, Chris, is how has VOILA Method helped you personally?
That is a big question. Hard to describe in a matter of minutes. Most simply, it's in many ways opened my eyes, given me a look behind a curtain that I didn't know existed, if that makes sense. With the actual technique tools themselves, I've been able to assess my own conditions and treat them effectively, so I don't have to see a chiropractor or a massage therapist as much. It's helped me with dealing with emotional traumas, things of that nature. So overall, I feel like it's helped me be a better version of me, where for many years I was not thriving, very closed-minded, in much pain. This therapy has single-handedly made me the version of me that I'm actually proud to be for once.
Beautiful, Chris. Beautiful, Chris. And it's been really amazing. Obviously, we've been friends for quite a while, and just to see the changes in both of us over the years, you know. So I think that's the thing that I'm most proud of with this method is that aspect of itself. Has VOILA Method kind of changed your practice a little bit, or what has it done for you?
Yeah, it's you could say it's changed our practice. From a practical standpoint, I used to see mostly running-related injuries, plantar fasciitis, IT band syndrome, shin splints. That was kind of my bread and butter. I would struggle very heavily with cases that there seemed to be something deeper, not just not just a musculoskeletal condition. Like you said in the intro, that this work does bridge the mind, the body, and the spirit. And oftentimes, the non-physical is where those issues are. So being able to tap into that and make corrections there, it's amazing how a small change in the mind or the spirit can affect the body. Mm-hmm. So instead of just seeing people with soft tissue pain, we're seeing people with things like complex PTSD, anxiety, people who are broken. And when they leave here, they're not, which is it's the most fulfilling work I've ever done.
And it never gets old, does it?
Never gets old.
It's yeah,
never gets old. No.
Gives me goosebumps just listening to your story here, Chris. So obviously it's helped you in your sessions, and people have asked me like, well, is there something that you have found that it hasn't really worked for? And they're honest with me, and they're like, I really struggle with tennis elbow and plantar fasciitis, and I'm like, I used to struggle with those too, until I started using the VOILA Method, and now those are a piece of cake. I know you post some great videos of some very complex cases. Is there anything of one of those stories you'd like to share?
I mean, I could give a whole ton of weird stuff that comes in my office. I'll tell you when I took your first level class, I was very not open to taking it, but you were a friend, so I gave you a chance. Mm-hmm. And I took great pride in my skills and my knowledge of how the body worked. And I had a case with really bad infrapatellar pain. She had previous surgery on a meniscus, I think, and walking up and down stairs was the worst. Mm. And so I went and I did all my procedures to try to help with her knee. And when nothing helped, I was like, well, let me just try something I learned this last weekend. And the correction was here on the face. And I made the correction, and she stepped down off the step, and she looked at me. She goes, yeah, that doesn't hurt now. And I looked at her like, kidding me? And I took the chart in my hand and I threw it in the air and I walked out of the office. Out into the street. I may have said a couple choice words. I asked the question, did I really spend a small fortune going to chiropractic school, studying biomechanics, learning how the body works, taking thousands of hours of CUs when all I had to do was freaking help her know?
Right.
So, yeah, she did great. And something as complicated as trigeminal neuralgia has come in, where the patient had been to Mayo, Cleveland Clinic, other prestigious clinics, and you just couldn't get help. By using this tool in combination with another local therapist looking at another component, she's been pain-free for almost a year. And she was hopeless when she walked in my door. And when she left, she had hope.
That's beautiful, Chris. And you can see the emotion in your face even just talking about that story. And I think everybody has to have that, we call it the voila moment. You know, that aha, I had that when I first started doing this work. And I'll never forget in your first level 1 class, you were working with somebody that was fairly difficult. They had a pretty complex case, and you were just learning this, and you were a rock star. You were doing great, and then you got to something you couldn't correct with her, and you went, "Can I correct this?" And you got no. Can Joel correct this? Damn it, Joel can do this.
Yep.
Yeah. But and that's one of the things that we want to talk about, though, is that Voila is a standalone method, but it also works synergistically with a lot of other modalities. Because I know you've taken thousands of hours of continuing education credits, and can you tell the people maybe how you can use Voila as a standalone, but also how synergistically you use it with your chiropractic and other things that you use?
Sure. Without giving too much away about the therapy for those who haven't taken it, I have been told by numerous systems that our work will work seamlessly with what you already do, and I found that not to be true.
Mm-hmm.
Kind of like if you take this really complex system, you end up just doing that. You will forget everything you learned before, and you do that. It's not that way with the VOILA method. Literally, I've taken your work and I've modified it and created kind of a triage system. So when somebody comes in, I use my VOILA assessment, and I take other assessments that I've learned and I plug them in. And I take therapies and I plug them in. For instance, somebody has low back pain, without giving too much away. I may correct the movement through an SFMA pattern. I may correct a soft tissue issue, but I go in and I'm able to ask the brain specifically what soft tissue therapy would be ideal and what soft tissue is the pain driver. So by using the assessment tool, I don't have to guess what's going to be successful for that person. I'm able to go in and ask them specifically what's going to fix you. And it is rare that somebody walks out of my office not feeling a lot better than they came in. So I can use it with tape. I can use it with needles. I can use it with soft tissue therapy. I can use it with rehab. Your imagination is your only limitation.
Yeah, that's one of the things we say in the class, right? In level 1, the only limitation is your imagination. And just to follow up real quick with the tape, and that's why I don't use tape a whole lot, but I do use it occasionally to help support the client. But you get to use the Voila assessment to find out how to put the tape on and what direction you need to pull it and whatnot. And sometimes it's opposite of what you think.
Absolutely.
That's the difficult part, and it's again going back to you being having that open mind to like going, wow, I was wrong. Body wants this instead. We just had a AK chiropractor take the course this last weekend, and he was telling me his AK assessment could take up to 90 minutes.
Mm-hmm.
And that was over for the session, so the client would have to come back for the treatment another time. And he just realized that was ridiculous. I shouldn't have to do an assessment for 90 minutes. So, you've talked about a lot of different conditions that you have seen, the trigeminal. You had another great one. I think it was a young girl that couldn't squat. Her knees kept dropping in, going valgus.
Yes.
That was a fascinating one.
Yes, it was. Want me to elaborate on it?
Well, we talk about gait in the Voila method, but and that's the other thing that you talk about, and this is what you're so great with, is because you're a sports chiropractor, you understand movement. We've been doing movement our whole life, and you can use the Voila assessment in the moment, at any time, at any place, and find out where in that movement the person is having the trouble. So what did you find with this lady with the valgus knee?
With the valgus knee, a little backstory on her. She has stress incontinence. She does CrossFit, so she has bladder. She's doing that. She has done several months of physical therapy for strengthening, the hip extensors, glutes, abductors, things like that, which is pretty common in our field. But what we did find for sure is when I went through and ran assessment, the pelvic floor was dysfunctional in almost every position, and it was definitely dysfunctional whenever she would do a squat and a jump. So, but the cause of the pelvic floor weakness was more of that non-physical. Had to do with emotion stemming from a divorce, not feeling strong, not feeling self-worth. Making those corrections is what brought back the pelvic floor. And then I did a simple test that somebody else probably made it up, but I use it. But I had her actually squat and try to push her knees out against me the whole way, and found a specific place where she collapsed. I made the corrections there for that one spot in her movement. And then 20 minutes after we started, there was literally no knee buckling. 2, 3, 4 weeks later, even still, no knee buckling. She sent a text message to me and said, I set a personal record on my front squat today of 40 pounds. And she's a CrossFitter who's very good. So 40 pounds is a big jump. And she goes, I'm going to pretend that's not related to our session today.
That's usually the case. Yeah. Every athlete I have worked on, and even non-athlete, they have all had a personal record after the session. And I think you touched on something very, very key there, Chris, and I want to talk a little bit more about, I'm going to let you go here because I know you're short on time, but the VOILA assessment, we don't guess, we assess. And what I mean in this situation is you were able to pinpoint exactly the spot in her squat that she fell apart. Yeah, when she lost that equilibrium. Yeah. I think that's, some of the power of the VOILA method. You can tell specifically, you're not guessing. You're like, nope, when you hit this level of your squat, this is where we need to make a correction. So that's why I love watching your videos.
That's what's neat is people on a video, they can't see pain, but they can see movement.
Yeah.
They can see when the body responds. And I've used, like I said, I've taken thousands of hours, learned from a lot of really good movement gurus. And I have yet to see a therapy that can make a change like VOILA method, and not only make a change so quickly, but permanently. Every time it still blows my mind.
It does. So Chris, that's a great statement in itself, but is there anything that you would maybe say to someone who is thinking about taking the class?
Yes. What I would say, and this is kind of poetic, is that I took great pride in my manual skills, great pride in my eyes, which were my best diagnostic assessment skills. That's my best tool by far. And since taking this work, now I close my eyes to see. I see a lot more when I'm not looking.
Yep.
And before taking this class, like I said, I cared very much about all the letters after my name. And I don't care anymore. I don't care what my colleagues think. I don't care what other people think about what I do. I feel free of those shackles. And I feel more confident than I've ever felt to do the work I know is best to help their patient. And instead of me doing the work, we're doing the work. The patient and I are one.
Yeah.
And I get more hugs and more tears than could ever imagine. The work is more fulfilling than anything I've ever used. It's why I'm on this earth.
Beautiful, Chris. Thank you so much for bearing yourself and sharing that. Because you are a master of touch and what you see, and that's how we really became friends. Is I felt your touch, and I was like, something special about this guy. But seeing you here now and today, because I haven't seen you in a little bit, and just seeing how comfortable you are in your skin, it's making me a little emotional just seeing it. It's beautiful. I love you, Chris, and keep up the great work. How can people find you on social media? I know you're so busy. You've got to hire more chiropractors, and I think, Chris, you are the only chiropractic office that uses. I think every therapist or chiropractor there uses the VOILA method.
Absolutely. Yeah. Another interesting thing, when you do this kind of work, people will find you that want to come and be a part of it. So the two associates I have are fantastic, but they didn't come to me for my manual skills. They came to me because this was the piece that they were searching for. And as far as finding us online, I'm not a huge social media guy, but we do have a Facebook page. Just search for Tensegrity Chiropractic. Or for me, Chris Barnes, and you'll find where I work. But yeah, we keep most of our videos there on the website as well, which is TulsaSportsDoctor.com.
Beautiful, Chris. Thank you so much for taking a little bit of time out of your day. I really appreciate it. Very grateful for you.
You too, brother.
All right, buddy. Thanks so much. And you can find me on Instagram at VOILA Method, Facebook. We have a public VOILA Method page. And you can find me at www.voilamethod.com. Have a great day, everybody.